Good day to doctor and my fellow friends. We are from groups who is going to present rabies today. And our presentation will be mainly focused on clinical science and diagnosis. Next slide. So before we talk about the clinical science, let us talk a bit about the pathogenesis of rabies. So as you can see in this picture, a susceptible dog is being bitten by an infected animals. So the virus will enter to the dogs by replicating in the muscle tissues, and they will achieve entry into the nervous system, and they will travel along the spinal cords, and it will infect the dog brains and replicate and multiply in the salivary glands. So this will cause a change of behavior in the dogs. For example, like the quiet dog may become agitated, but the active pet may become shy. So the beginning of clinical symptoms will start following the incubation phase. So next slide. So now we enter about the clinical sign of the rabies. So the first stage of the rabies will be the prodroma phase. It's similar to the incubation periods. So the first stage of the virus will usually last about 1 to 3 weeks. So in this prodroma phase, the dogs will undergo the slight change of temperament, and then we can see the dog will show the primary clinical signs. And in this primary stage, clinical sign is usually non-specific, which is anxieties, anorexia, nausea, diarrhea, and pupil dilations. But when the disease go to the advanced stage, the dogs will show a very strange behaviors and result in the marked change of temperament. So the incubation of periods of the rabies in the dogs will usually last from 2 weeks to 4 months. Next slide. That's all from me.
Okay, so now I'll continue with one of the clinical signs of rabies, which is also known as dumb rabies. So this is the more common form of a rabies infection, where it involves a progressive paralysis involving limbs, distortion of face, and swallowing difficulty. So the dog would also experience weakness, loss of coordination, and eventually paralysis. Yeah, from the video you can see that the face is distorted, where the dog is experiencing a swallowing difficulty. This is due to the masseter muscle being experiencing paralysis. So this dumb rabies form will eventually cause a loss of coordination that leads to paralysis. Okay, so next.
Okay, next I will present on the clinical signs for furious form of rabies. The dog with rabies will be restlessness and also highly excitable. The dog will also become aggressive with excessive salivation. And then the dog will have hydrophobia, which they will have inability to swallow water. And also they will attack on animal, people, or animate objects. For example, they will swallow the foreign object such as stick, stone, straw, or feces. And then I will show a video for the clinical signs of furious rabies. For the furious form rabies, you can see the dog will be restlessness, and then it will also show irritability and aggression. And then the tail of the dog will seem hanging, and also there will be hypersensitivity to light and also sound, and we'll see hypersalivation also. Okay, next.
So I will continue on the diagnosis of rabies. So the first diagnosis of rabies is histologic examination. We can take a brain tissue from rabies virus infected animals and stain with hemotoxylin and eosin stain. And on the first picture, the blue arrow indicate the perivascular coughing or inflammation around a blood vessel. A perivascular inflammatory cell will infiltrate in hemotoxylin and eosin stained brain tissue. with 100 times magnification. And the second picture shows that negative bodies in infected neuron. Next slide. And the second diagnosis is direct fluorescent antibody test, DFA. So for the DFA test is based on the observation that animals infected by rabies virus have rabies antigen present in their tissue. So when lab antibody is incubated with rabies suspect brain tissue, it will bind to rabies antigen. So for the first picture, show that unbound antibodies which will wash away and areas where antigen is present will be visualized as fluorescent apple green area using a fluorescent microscope, which indicate that the DFA test is positive. And the second picture is if rabies virus is absent, there will be no staining. So the DFA test is negative. Next slide. And the third is amplification methods by reverse transcriptase polymerase chain reaction, RT-PCR. So for this procedure, the rabies virus RNA can be enzymatically amplified as DNA copies. Then the rabies RNA can be copied into a DNA molecule using a reverse transcriptase. The DNA copy of rabies can then be amplified using polymerase chain reaction. And this technique can be confirmed the DFA result and can detect rabies virus in saliva and skin biopsy samples. So the pictures show that the PCR test result for rabies virus, the arrows indicate the position of the positive bands. I'll pass to the next presenter.
Okay, so for the diagnosis of rabies, the gold standard will always be the detection of the virus antigen in the tissue sample, usually from the brain, which would require the euthanasia of the animal. So that means that there is no gold standard of diagnosis for any live animal as of the current standard now. So, but in a Thailand test and a report that what they did is that any suspected animals, they will quarantine it for up to 10 days. And this only applies for dogs or cats. And before proceeding to euthanasia, an examination by FAT test, fluorescent antibody test. So what they found out is that through this quarantining period of time of 10 days, they can correctly identify rabies cases up to with an accuracy of about 80 to 90%. And further on, there's also the mouse inoculation test, which serves as a confirmatory test to the fluorescent antibody test. So what the mouse inoculation test does is that it is a further confirmation to confirm whether it is a false positive or false negative to the fluorescent antibody test. So next slide, please. So this is the example of the mouse inoculation technique. So what they do is a brain tissue sample from suspected cases will be inoculated intracerebrally into mouse. And the mouse will be euthanized between 4 to 12 days or allow the virus to run its course between 8 to 20 days, where the mouse will die between 8 to 20 days if it's allowed, if the virus is allowed to run its course. And either way, using FAT on the brain tissue sample of the mouse, the rabies antigen can be detected if it's positive. So this is just used as a further confirmation to all the other diagnosis method. Yeah, that will be all from all of us. Thank you very much. So these are the references that we used.
Thank you. Thank you, everyone.